founder of Education and Research for Sustainable Development. And I'm also part of Inspire World Foundation team. I also lecture in one of the tertiary institutions in Nigeria.
Currently undergoing my MSc in Business Administration and Management. Aside that, I also own an organization named Our Mission Initiative, and I'm a field data collector with about 5 to 6 years experience in field work, and also on a farm in Kefi, which is Rajmat Farms Nigeria Limited.
I am a front-end developer and a graphics designer, and I participated with Inspire World International Foundation to gather data in different communities to assess prevalent diseases in different communities.
I am an entrepreneur. I'm into pastries and a whole lot. And I'm in this fellowship to be mentored by the organizer, which is Dr. Chris. The fellowship is a place where you will collect data first, and after the data being collected, a raw data, it will be analyzed, and then solutions will be brought out from the data being collected in my environment, like in my community where I live.
This year's theme, using youth-led innovation strategies to assess prevalent diseases in different communities. So as one of the fellows, my area of focus was one of the rural communities in Nasarawa State. I focused on Ako Village. One of the things I did during the fellowship was conducting qualitative research to assess the prevalent diseases in that community.
I worked with the IDP camps in Edo State, and other people also worked with some other communities, vulnerable communities across different states in Nigeria. So it's important to say that this is a data-driven project. And what do I mean by that? We started by research. We started by asking the people. We don't want to do a top-bottom development approach. So that is the first thing. So we went into the communities to find out what are the prevalent diseases or the health needs they have in that community.
The program is all about assessing health needs in communities. Like in this program, we have done for 40 communities. 40 communities, not just Abuja, but other states. In my community, I collected data. And in the process of collecting the data in my community, I found out a lot of things, because Duse is a place that is a suburban area where you have people defecate around, waterlogged area and all of that. And that area is a place that is prone, like if there's a cholera outbreak right now, trust me, a lot of kids will, God forbid though, but a lot of children will be affected, and even some might lose their lives because of the way the whole place is. And also malaria, it's prevalent there in the community. And in the process of this whole research, I have learned a lot of things, how to collect useful and meaningful data, and how to analyze the data, and how to bring solutions to the data. And it also helped me communicate with stakeholders more in the community. The mentorship process with Dr. Chris came in through a workshop, and then after the workshop, if I don't understand something, I'll chat him up and be like, okay, this is how it is. Okay, you should go this way, you should make it go like this and all, and one-on-one and through the workshop.
My experience with the fellowship has been really amazing. From the start of the fellowship, we had an introductory section that introduced us to the fellowship, and we were really taught how to conduct research, and we were also taught how to use social media as a tool to project our work. And during the fellowship, which involved me going to conduct research in the rural community that I use, one of the things that I learned was youth engagement is very vital, because youth engagement, whenever you're conducting projects, helps you to get creative and comprehensive analysis of the approach that you're going to use. Then another thing that really stood out for me during my work or during the fellowship was proper community entry. One of the things I learned is that you have to engage the stakeholders, because when I was conducting the research, I realized that because I had spoken to the stakeholders, the gatekeepers of the community, it made my access to the community very easy. And during the fellowship, we were also taught step-by-step approach to developing solutions for communities. I learned that following a step-by-step process, doing your research, doing your analysis, and then analyzing the data and then developing solutions helps you to develop targeted solutions that is able to target the specific needs of a particular community.
We had a sampling technique, and the sampling technique we used was a simple random sampling that makes sure that every member of that community has an equal chance of being selected. It's also important to state as well that prior this one we did, we had a qualitative data phase where we conducted what is called exploratory study. And what we did there was to interview the gatekeepers, what we call gatekeepers, important stakeholders, to find out, is this even an issue? So that we don't end up going into the community interviewing thousands of people, because this project has reached out to around 3,000 to 4,000 people. So, but what we did was to do what we call exploratory interviews. It's a qualitative interview.
Inspire Words International Foundation Social Impact Innovation Mentorship is a wonderful program. At first, when I saw the application, I thought it's just a random activities, a random fellowship which we undergo and come back. But frankly speaking, today I'm bold to say that for the past 6 to 5 years I've been in the field work. I only collect data, send it to organization, but analyzing it to see what the end result is, I don't know. But coming down to this place today, I was able to realize that after the field work, there are other works that which are more hectic than that we encounter in the field. It's an experience that you encounter in the field. Sometimes you meet people, but we don't know. After the field, there are things you need to do in order to bring it to a meaningful, to make it meaningful. And these are something that most of us that found ourselves in the field don't even know, that after we collect the data, there are other phases to encounter. And today, I'm boldly to say that I collected data. I was part of the start. I was part of the process who analyzed the data and even propound a solution to make the data a meaningful solution that even a layman on the street can read through the content and know this is something that has been collected somewhere, and this is what the community is facing, and this is the end result.
First of all, I met the chief of the area, which is the Hakimi of our area. We call him Hakimi. Yeah, and he complained about water, clean water. There's no clean water in the area, which is true, because at times when you get to their boreholes and then you try to fetch water, even in my compound, you see maggots like worms, black worms. Yes, and I keep having my son, my second born, is always falling ill because of the dirty environment also around there. And also there are people that there are people that are not ready to listen. They're not ready to learn, like on how to clean their environment, on how to prevent a lot of things. And so with this, it's an eye-opener. Like, we should go to the community and sensitize them in the community. First of all, I would just want the environment to be cleaned first, because when it's cleaned, at least you're preventing mosquitoes from coming around the area. Then treatments can be given, and also the mosquito nets and all that. First of all, we just need a clean environment, and then the clean water also to prevent cholera and typhoid.
Right now, we are done collecting our data. We have analyzed our data. So we are currently on what we call a co-creation workshop, where all the participants or the people, the research assistants who gather this data come together. We look at the data, we discuss the data, we discuss the findings. We said, okay, what do we do with this data? So right now we are on our co-creation workshops, with over 40 young persons. And it's also important to state that this is a youth-driven project. In other words, this project utilizes influential young people who understand the communities, who are also working with their community. So they're not just going into the communities like greenhorns, no. They are going there knowing fully well that, okay, this is a community I know, or I know someone who understands the demographics of this community and can be able to tell us, okay, this is where you should go to and this is where you should not go to. But the most important thing is that it is a data-driven project and it is a youth-led project, also involving the communities as well.
From the data that has been collected, one of the things I'm going to do right now is develop local solutions that using the data that are going to target the specific needs of different communities. And I'm also going to collaborate with my different team members with the different communities they've worked with to develop local solutions for these communities.
We are at the last phase of the project objective, which is designing interventions. And we won't just design this intervention and begin to implement. After we are done designing this intervention, we are still going to gather the stakeholders, the community stakeholders, and say, okay, share the data with them, share the information with them. It's called data dissemination. Disseminate our findings among them and tell them, okay, this is what we found, these are the interventions we have. I hope this is okay with the community because it's based on what we found. And if it's okay and everybody is on the same page, all of us now go in and implement the intervention. So the next stage is the implementation phase. And it's also very important for people who care about the health of the population, to be part of this project. We need funders, we need grants to execute this last phase of the project. We need partnerships, we need collaborations. So it's very important, to care about the population health, because what affects someone in one way or the other also affects other people. So population health is everybody's business. So we are at the implementation phase and we are calling for partnerships. We are calling for collaborations to make this a reality. Since we have data, we have something, we can boldly say that these are the facts, these are the issues.
I want to really thank Inspire World International Foundation. I want to thank Brown University, and I want to thank Futures Fellows Lab for their investment, for their partnership, for organizing this fellowship, because this fellowship has gone a long way to teach me as a person that I am not just a community member, but I'm a significant member of every community, every part, everywhere I see myself. I should learn how to develop creative and digital solutions that solves the problem of every community that I find myself into.
I really want to first and foremost thank the convener of the project, which is Mr. Chris, the founder of Inspire World International, because without him, this knowledge wouldn't have been in me. And the other partners, which is Brown University, I want to thank them and I want to acknowledge them, because it is their effort that make us to be here, and it is their effort that build something in us and inspire us to do more. I believe that they should not stop where they are. They should keep on impacting young people like us, because it is with this their effort that the society will be better tomorrow. I want to say thank you for this privilege and wonderful opportunity, and I wish that one day I will be part of this project in the future, or I will one day call on young people the same way Mr. Chris did today to learn from where he stopped.
I would really like to say, start by acknowledging our respondents, because without these people, we wouldn't be here. People gave out their time, people gave out their consent to participate in the study. We had people who took us around the communities. We had people who worked with us as interpreters. We had people who, who made sure that we were safe in these communities, because some people actually worked in hard-to-reach areas. Some people worked in settlements. So I'll start by acknowledging them and by saying thank you to them. And then I also acknowledge the young people, the influential leaders in their communities who diligently, the key word here is diligent, because there are some people that, when you give them work to do, when you ask them to go out there and collect data, they just sit in the comfort of their room to manipulate data. But when we conducted our analysis, had some checks, had some balances, we saw that truly these people were out there in the field. I personally acknowledge these young people, about 40 of them, that took painstaking effort to collect this valid and reliable data. And I also want to appreciate the Inspire World International Foundation through the executive director and the co-founder, Dr. Chris and Shola Chukwunyere. They have been doing an amazing job in terms of the health landscape in Nigeria. Apart from this project, there are so many wonderful, great projects, highly impactful projects they have been doing. And what really stands out in their projects modalities is they stick to best practices. They don't jump any process. They take it step by step. So they have done well. And then the School of Public Health, the Brown University, the Future Information Lab. We also acknowledge their effort, because we understand here that down Global South, there is a whole lot of challenges. But it also takes interest for people to key into this. These people who are supporting this project, they are not Nigerians. They may never even be to Nigeria. But because of their interest in the common good, they said, okay, let's come down to help these people. And I want to assure them that whatever single resources they have put into this project, call it the financial aspect, call it their time, call it their intellect, at the end of this project, as they can see already, they will definitely see that it was worth the weight in gold. And I can assure you that at the end of it, I believe that there will be a drastic reduction in the prevalence of all these disease conditions we have found, because the kind of interventions that these intelligent and brilliant young people are coming up with based on the data, it's something that will really be impactful to the communities.
Okay, I would want to say thank you to all the partners that came together to put this social impact innovative program together. And this program has made me learn a lot. I would love to use what I've learned to impact and transform my community. One, by making it clean and to prevent a lot of prevalent diseases like cholera and malaria.
Hi, my name is Chris Chukwunyere and I'm a 2023 Information Futures Fellow. It has been an amazing 6 months of working with these young people across 7 states and the Federal Capital Territory in Nigeria, conducting community needs assessment and developing solutions that will address the health information needs across these communities. There are 40 of these young people. So this is just Abuja and Nasarawa hub, and we are using this opportunity to say thank you very much to Brown University, thank you very much to the Information Futures Lab for organizing and supporting me to work with these young people to implement this project in Nigeria. So guys, what do we say to Brown University?
Thank you, Brown University.
So what do we say to Information Futures Lab?
Thank you, Information Futures Lab.
Awesome! Thank you.